Even as the country awaits the Friday extraordinary summit between the President and the Council of Governors, the key question really is, how prepared are counties to handle COVID-19? As Dorcas Wangira now reports, Doctors' Umbrella Union KMPDU says the health workers are overstretched and may not cope with the surge in numbers in the next 2 weeks.
Nairobi may still be the center of COVID-19, but the war against full-blown community spread is also being fought in the counties. But just how prepared are the counties as we brace for a peak and a spike in infections? Monday, 12 doctors in Nyeri County were among 19 people who tested positive for COVID-19, raising the number of positive health workers to 526. The Doctors' Union now foresees a crisis in 2 weeks, given the growing number of infected frontline workers.
And we are at a point where healthcare workers are burnt out. KMPDU has a database of 1,000 medical doctors, pharmacists, and dentists who are willing and ready. And we are hoping that in the next 2 weeks, these healthcare workers will be on the ground. Otherwise, you will have no healthcare workers to take care of you. Because every single day, we have more and more healthcare workers going into quarantine and testing positive.
As of July 15th, according to the Council of Governors, all 47 county governments had cumulatively set aside 271 isolation health facilities with a total of 12,034 beds, with 447 ICU beds and 437 ventilators dedicated for COVID-19 treatment. 26 counties had attained the minimum required capacity of isolation beds. However, some counties were lagging behind, such as Lamu with 30, Tana River with 43 isolation beds, Marsabit 50, Siaya with 66, Kitui 70, Kisumu 87, Wajir and Bomet 95 each. A county like Vihiga, according to the list, has 300 isolation beds, but no ventilators and no ICU beds. Other counties had higher capacity, such as Machakos with 463 beds and Bungoma with 404 beds. Kiambu County is also in a private-public partnership to boost its isolation bed capacity by commissioning the construction of an isolation unit at the Kiambu COVID-19 Center in Tigoni.
If a place is overwhelmed and they are trying, but they're overwhelmed, then we have to accept them. And I'm willing to accept anybody where you're overwhelmed. But if you're overwhelmed because you haven't done your job, you haven't put your act together, then why am I being burdened? By the beds. I mean, hire more health workers.
We must increase our capacity to test. We are working on Mokoroini Hospital, which has 130 beds, to improve the capacity. We must make decisive decisions and decide whether we will continue allowing our people to walk in and out.
Besides isolation and treatment facilities, personnel and having adequate PPEs, sensitization of the masses on the do's and don'ts, and creation of awareness on the dangers of COVID-19 among the county populations remains a key priority. Delays in the disbursement of funds to counties, occasioned by the standoff over the revenue-sharing formula, further complicates matters in the counties, as some are already facing financial crisis. Dorcas Wangira, Citizen TV, Nairobi.